Greetings to you. My name is Lauren Paremoer. I'm a member of PHM South Africa, and I've been asked to speak about the impact of EU policies on access to vaccines, medicines, and medical tools. And I want to do that specifically in relation to the COVID-19 pandemic. So, as we know, I live on a continent, Africa, that's the least vaccinated globally. And this is in a context where people in the global north, broadly speaking, often have not only been fully vaccinated, but have received booster shots and have had access to things like diagnostics that allow them to test whether they're COVID positive and therefore to make informed decisions about where they go, who they see, and the terms on which they do so. On my continent, things are very different. And this, one of the main reasons for this would be the intellectual property rights policies that artificially limit who can make COVID-19 vaccines, but also that ultimately limit things like access to diagnostics and increasingly the new COVID-19 therapeutics that are coming to the market. So what is a concrete example of that? Well, one concrete example is the EU Commission stance on the TRIPS waiver request that was tabled by South Africa and India in October 2020 at the World Trade Organization. The waiver request asked for intellectual property rights to be waived on all COVID-19 vaccines, therapeutics, and technologies, and ultimately it was an opening move to ensure legal certainty, so to ensure that where non-patent holders were able to replicate technologies, that they could manufacture these in order to treat and manage COVID-19 without legal retaliation. But it was also more than that. It was a request that knowledge production shift from the global north to the global south, and particularly knowledge production in the area of pharmaceutical manufacturing. And of course, this would happen more speedily if scientists and pharmaceutical corporations in the global north shared not only their intellectual property, so open technology, but also if they shared their know-how, their information, their tools, their tricks, their techniques on how to make COVID-19 vaccines, diagnostics, and therapeutics. So the COVID-19 pandemic certainly led us to reflect in the same way that we did during the HIV/AIDS pandemic on the ways in which the trade-related aspects of intellectual property rights framework that was institutionalized in 1994 by the World Trade Organization. It led us to reflect on the ways in which that framework ultimately limits equitable access to life-saving medication. And unfortunately, what's happened subsequently is that the TRIPS waiver request has received a lot of support globally, predominantly from nations in the global south, but it's not received support from nations that host large pharmaceutical corporations, and this includes the European Commission, which has not been supportive of the TRIPS waiver request as formulated by the initial sponsors, and has instead insisted that states use standard TRIPS flexibilities to promote access to patented COVID-19 medical technologies. And so the very real consequence of this is that it's been very difficult for new producers, new manufacturers of COVID-19 technologies to be able to develop the know-how and expertise to produce these technologies. And ultimately what that has meant is that there has been a limited supply of vaccines, for example, available on the global market. It has meant that global pharmaceutical corporations have total control over the prices at which they sell these technologies, and it's also meant that in the presence of limited supply, pharmaceutical companies have effectively prioritized sales to governments in the global north. The hope with the TRIPS waiver request is that, at least in terms of manufacturing, that this manufacturing base can be expanded through technology transfer. And the ideal situation, of course, is that this should be done through voluntary cooperation between big pharma and countries that seek to develop this technology in the global south. Unfortunately, that's not what we've seen. And certainly the EU proposal, which is discussed at the World Trade Organization, is one of the possible paths to follow, that we use existing TRIPS flexibilities, doesn't take into account how slow and cumbersome such a process would be. It would take a lot of legal and bureaucratic effort. That certainly would slow down the response of governments in the global south in the context of this massive COVID-19 crisis. So in this sense, it's not necessarily a feasible pathway. And also the use of TRIPS flexibilities has historically been met sometimes with retaliation and outrage by countries that feel these flexibilities should not be used. And so, for example, South Africa in the late 1990s ended up on a special trade watch list that the US Trade Representative put it on for seeking to use TRIPS flexibilities to facilitate access to patented antiretroviral medications. So certainly in this sense, one of the concrete things that citizens and organizations in the global north can do in order to facilitate increased access to COVID-19 technologies would be to support the TRIPS waiver, and also to put pressure on their governments to hold pharmaceutical corporations accountable for actions that they might take that hinder technology transfer. And so certainly one of the possible options here would be to put pressure on pharmaceutical companies based in the global north, for example, Pfizer in Germany, to put pressure on them not to take out patents on new COVID-19 therapeutics anywhere, but particularly in the global south, and also not to take out patents on COVID-19 vaccines. It's an uphill struggle. It will take a lot of mobilization and pressure, but certainly this kind of tactic is one of the tactics that we could follow. I think also, more broadly speaking, one of the things that we could look back to would be the UN High-Level Panel on Access to Medicines and some of its recommendations. And so more broadly thinking about the context beyond the pandemic, there is still a need to look at the recommendations and to support recommendations that came out of that report. So for example, excluding TRIPS plus provisions in trade agreements, which narrowed down quite often the space that states have to use TRIPS flexibilities, and also to make sure that institutions that receive public funding for research, particularly research into medical technologies, that they prioritize public health objectives over profiteering. And then finally, one of the other things that's really, really important is to pressure private sector companies regarding their research and development process, their marketing, their manufacturing costs, and so forth, so that there's greater clarity actually on what drug development costs, how companies decide which drugs to prioritize in terms of research and development, and also to increase transparency around the kinds of contracts that these companies conclude with governments. And so in this sense, there is a need to look at the broader infrastructure that surrounds trade and health. And this is certainly something that won't be resolved by the TRIPS waiver, but I would argue that the TRIPS waiver is a first step that one could take. It's a kind of entry point into thinking about these other broader structural reforms that are needed.